Mike Stoller, Human Service Council. Next is Denise Harlow.
Good afternoon. I'm Michael Stoller, the Executive Director of the Human Services Council of New York City, and with me is our Deputy Executive Director, Allison Sesso, and we thank you very much for the time you're giving us to testify today. And also thank you for your patience in staying and listening. I want to try to put things in context. A lot of the folks you've heard from already, and some you're going to hear from later today, are members of the Human Services Council. We represent all the social service not-for-profits in this city, people who provide everything from child care, child welfare, services for the elderly, services for the homeless, the gamut of human need. So you heard from a number of the speakers specific requests for restorations or for fees. What Allison and I want to do is kind of set a context for where we are. This room has a capacity of 500. If you multiply this by 5,400, imagine 500 people walking in, walking out, 5,400 times, you'd get the number of people below the poverty level in New York State. It's mind-boggling. The poverty level is 22 grand for a family of 4. I live upstate, I work downstate, and in neither area can you support a family of 4 on $22,000. There are 800,000 people unemployed in New York State. Those are the ones we know are unemployed because they're still looking for jobs.
The assumption the wife isn't working.
Sorry?
I was just thinking, to have 4 assumes there's a wife or a husband. One of them is not working to be at 22 if they're getting the legal rent. I mean the legal payment. I'm sorry, I just do numbers in my head.
No problem. It's a long day. So I want to set this context. There's always poor. We always get hit with budget cuts. But with the Great Recession, while Wall Street is making money, these people have less. And there are more of those people. It is the perfect storm. There's less philanthropic dollars. There's less government dollars. There's more people with need. I want to talk about shared pain. We agree, pain has to be shared. These days, we know there's going to be cuts. And as Senator Kruger said before, I hope they're not just, frankly, mindless across-the-board cuts, but targeted cuts. But while you're cutting us, and while the public sector unions are obviously going to take their hit, there's another sector that needs to share a little pain too, and that's the people who have wealth in this country and in this city and this state. What we're asking for, they just did a study in Jersey, a comprehensive study of where New Jersey wants to be, going down to the bottom. What services do we want the government to supply? At every level, state, city, county, school district, they drill down. What services do we want to supply? How's the best way to supply it? And how do we pay for it? And one of the things we want to urge in that is to New York to do the same thing, to look at our tax structure. Yeah, our taxes are too high. Somehow our revenues are too low. Something's off. We wouldn't run our homes like this. We, and for the Human Services Council, are asking that while other services are included, cops, fire, obviously needed, the safety net has to be preserved as well. So when we look at this whole tax structure, and we look at the whole spending structure, government needs to keep its commitment to its citizens, which means they're fed, they're housed, they have health care. So while that study, which we implore the legislature and the governor to undertake, while that study goes on, someone has to take care of these 5,400 times 500 people sitting behind me. And that's you. And one of the ways to do it, and this is not a new tax, is to continue the PIT surcharge. That's their share of the pain. I know that's a heavy lift. And there are other revenue ideas that were brought up by previous speakers. But while we're sharing the pain, until we can figure out how to make the whole system work, we need that PIT surcharge extended. HSC has started a campaign. You probably got it in your mailbox and on your email, called Who Cares? I Do, It's a statewide grassroots campaign to let people know who we're talking about when we're talking about human services. My dad, God bless, 87 years old, lives in the Bronx, goes every day to his senior center a few blocks away. He gets lunch and he gets companionship. Would he die if he didn't have it? No. But would his quality of life be really adversely affected? Yes. And does society owe him that for the years he put in as a father and a husband and as a worker? Yes. No question. And I know I'm speaking to the choir. But you have the power to make sure that keeps going while we get past this incredible fiscal crisis. And one of the ways to do it is the PIT. The other way to do it is you could sign on to our campaign and let your colleagues and folks know. We want to really let people know how important this stuff is. Allison will speak a little more about these specifics.
Hi. I just want to point out that overall there's $400 million that we know about that's in cuts to human services, which is a huge number for services that over the last couple of years have been whittled away at. I mean, this fiscal year, actually, we had a 1% cut across the board, and service providers are supposed to do exactly the same amount of work for less money. Last year, in order to fill a budget gap, we had a charitable deduction change that made it less attractive to give money to nonprofits. You have the MTA tax that nonprofits have to put up with. You know, this is going on at a time when need is skyrocketing. So we need to make sure that we have a healthy and strong nonprofit sector that's able to meet this growing need and to get us out of this great recession. So $400 million is an important number. And on top of that, we don't even know what these Medicaid cuts are going to mean for our services as well, and that's just information to come. Tomorrow, Mayor Bloomberg in New York City is going to be proposing the city's budget. And I know there's going to be a ton of cuts in there to human services as well. So you're compounding on top of compounding on compounding on top and on top and on top. And the nonprofit sector is at the brink. And they're right there at the brink. And they're trying to help clients that are on the brink. And yet the workers themselves are about to be clients themselves. So we need to make sure that we take a hard look at our choices here. And again, personal income tax, we need to keep that going for the short term until we figure out how do we make sure that these services are in our communities, continuing for the long term. And you know, as the previous speaker talked about, this increase of a child welfare background check. It's okay to raise $12 million that way, but it's not okay to have a personal income tax extended. That's just the wrong choice in our opinion. And so let's take a look. We won't go into the details of all of the budget cuts. People have reiterated them over and over again, but I think we just want to push back and say, we do care, and that's why we started this campaign, and we have to make sure that we make the right choices around this budget.
In conclusion, we just want to make sure, since this came up a number of times, and we want to be on record for this, we believe discretionary funding is not pork, that the New York Times is wrong about that, and that the $85 million supports needed services, which you know the best because you know your communities, and we're hoping that that's restored. We know that's a long shot, but we are hoping it. We also want to say we do support the governor's program to close underutilized jails and juvenile justice facilities. They're underutilized. They should be closed. Thank you very much for your attention, and we're welcome to answer any questions.
Thank you very much. Questions?
Thank you.
Thank you.